Hello, my name is Tangiwai and this is my simulated practice video. I am attending a 24-year-old female named Zara who has fallen from a ladder and became unconscious. On arrival, Zara is sitting up in her house and able to ask questions. However, her speech is slurred and her responses are delayed, and she is unable to recall events leading up to the fall. Based on this, I've given her a GCS of 14. I continue with her primary and secondary assessment, plus her vital signs, and they've all come back normal. However, because she's fallen unconscious with this fall, and because she is showing a GCS of 14, I strongly and clearly recommend her being transported to hospital, and this is all shown in the video. It is important to have a good grasp of the consumer's rights, particularly Right 5, Right 6, and Right 7, which talk about informed consent and communication. Because my patient is having trouble understanding my questions, I slow my speech and I speak clearly and slowly to help her understand. When assessing her capacity to make informed decisions, I make sure she understands the information that I'm giving her, that she's able to retain it long enough for her to make that decision, that she's able to use and weigh her options for the benefits and the risks of staying home versus transporting, and that she's able to communicate her wants and needs with me properly. Oh, right, Zara. So your vitals are stable, your pulse is regular, your blood pressure is good, and your oxygen levels are sitting at 99%. Secondary survey didn't show any major signs, but given you've had a fall with a loss of consciousness and your GCS is sitting at 14, it fits a lot of the red flag criteria for a mild CBI and the CPGs. So I'm recommending visual transport for neuromonitoring and...
Wait, you're talking really fast. What's a GPS? What's a CGS?
Oh my gosh, I am so sorry, Zara. I was speeding through that, wasn't I? Let me try again, slower this time. So basically, you've fallen from a ladder, you're a bit confused when I first got here, and you said you can't really remember exactly what happened, right?
Yeah, I remember being on the ladder. The next thing, I was on the ground, and then you were here.
Exactly. And that little gap in memory, plus how you were kind of foggy when we first spoke, that tells me your brain might have taken a bit of a knock. Even though you're talking okay now, and your numbers look good, we don't mess around with brain injuries.
So, you think I hit my head pretty hard?
It could be something mild like a concussion, but there's also a chance, even a small one, that there's something more serious going on, like bleeding or swelling in the brain. It might not show up straight away, which is why I'd like to get you to the hospital so they can keep an eye on you and maybe do a scan.
Okay. Is it really necessary though? I feel alright now.
Totally fair question. A lot of people do feel fine at first, but that doesn't always mean that everything's fine inside the head. That's why the guidelines say that if you've got signs like confusion, memory loss, or a fall from a decent height, we should treat it seriously. You've ticked a few of those boxes, so I'd rather be safe than sorry.
Right, yeah, makes sense.
So just before we do anything, it's important for you to make the final call. My job now is to check that you've got capacity to decide. That means, do you understand what's going on? Can you think about the options and tell me what you want? Does that sound alright?
Yeah, I think so.
Cool. So we'll run through it real quick just to make sure. Can you tell me what's happening right now?
I fell off a ladder. I think I hit my head. I was a bit out of it when you arrived, when you got here. You're saying it might be an injury?
Yeah. And what do you reckon could happen if we don't go to the hospital?
It could get worse. Maybe bleeding or something?
Exactly. That's what we want to avoid. You seem a lot more switched on now, which is great. But with head knocks, things can change fast. So we like to keep people under observation for a few hours just to be sure.
Oh, yeah, okay. I think I'd rather go to the hospital. Better safe than sorry.
No, good choice. You've clearly understood what's going on, thought it through, and made a call. So that tells me we've got full capacity to consent. We'll get you to hospital now and I'll tell them exactly what happened and what we've done so far. I'll be with you the whole way, alright?
Yeah, thanks. You're really good at this, by the way.
Thanks, Sarah. Let's get you moving. I've got a stretcher with you.